This video presentation will be presenting recommendations in addressing the under-identification of mental health issues for older people. This presentation aims to present recommendations on how can nurses or other health professionals practice to address concerns identified in upskilling in recovery-oriented care of the older person with mental health problems. Secondly, it aims to identify ways on how nurses work in collaboration with older people experiencing common mental health disorders and the risk of suicide. Thirdly, is to discuss ways of effectively supporting older people experiencing mental health illness and their family and carers to promote empowerment and support personal recovery. Fourthly, is to present strategies to promote healthy aging. Lastly, is to provide information relevant to the role of nurses and GPs and giving them practical evidence-based ways to issues related to older persons' mental health. Health problems are under-identified by healthcare professionals and older people themselves. The mental health of older person is as important as other people in any life stages. Stigma and ageism are barriers to older persons' mental health. After the significant number of deaths in nursing homes, depression was proven as not a normal part of the aging process. Self-determination has been identified as key to recovery. Autonomy, competence, and relatedness is what constitutes self-determined individuals to feel self-motivated and self-directed. These are the recommendations of how to best address the under-identification of mental health issues for older people. Firstly, the barriers to social supports, healthcare access, ageism, and stigma to early identification of older persons' mental health and health seeking needs to be addressed using Commonwealth Home Support Program and Community Visitors Scheme. Secondly, education and training to improve the quality of older persons' mental health care, continuing education and training courses, including components of training courses such as skill sets and micro-credentials relevant to direct care skills, including but not limited to dementia care, mental health, palliative care, oral health, cultural safety, and trauma-informed care. Lastly, is designing mental health care plans for diversity, difference, complexity, and individuality, particularly in rural areas where Aboriginal communities and culturally and linguistically diverse communities reside. These are the recommendations on how can nurses, researchers, or other health professionals practice to address concerns identified in upskilling in recovery-oriented assessment, care, and treatment of the older person with mental health problems. Firstly, is the extra support for health professionals and families in the identification of older persons' mental health with disabilities. Secondly, is to develop a comprehensive provider search function on My Aged Care portal that allows people to review and compare using consistent, accessible, inclusive, reliable, and useful information about the aged care system and aged care providers. Lastly, is empowering services including GP practices, community homes, and aged care facilities that encourages older persons' personal recovery, including self-determination and dignity. These are the recommendations on how nurses work in collaboration with older people experiencing common mental health disorders, including depression, anxiety disorders, substance use disorders, and schizophrenia, and the risk of suicide. Firstly, is the third monthly collaborative risk assessment, mental health review, and safety planning with the older person and the multidisciplinary team. Second is encouraging and assisting older people to accessible resources and digital literacy, including access to online self-tests, self-directed care planning, and support such as Beyond Blue, Black Dog Institute, Health Pathways, and GP Shared Care mental health clinics. Lastly, is empowering older people by assisting in accessing resources for harm minimization related to dual diagnosis and increasing awareness on the effects of different substances. These are the strategies to promote healthy aging. First is doing personal enjoyable hobbies such as outdoor activities, exercise, including goal setting. Secondly is meeting up friends in person, phone, or social media. Third is accessing online resources and digital tools. Fourth is reaching out to local communities, new people, and professionals for health specialist care. Fifth is positive mental health attitudes. And lastly is promoting nutrition and balanced diet. As mentioned earlier, these are the resources for nurses and GPs, including Health Pathways Sydney, Black Dog Institute, Way Ahead, and Beyond Blue. Thank you for listening.